Good afternoon, and welcome to the Your Health radio and television program on the radio at AM 1240 KNRY, AMP's Cable Television Channel 24, and on the web at www.ampmedia.org. Join our rotating host and their informative guests live every Monday afternoon at 4 o'clock. The purpose of the Your Health radio and television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Welcome back to Your Health radio and television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm so happy you could join us today. My first guest is the distinguished Sophia Mineyev. Sophie, welcome. Thank you very much for being here. We're going to talk about medical hypnosis and hypnotherapy. That's a very fascinating concept.
Yes.
Now, Sophia, before we get into that, I want to know about you. Let's tell our audience, whether they're listening or viewing, a little bit about you. Tell us about your training and where you grow up and where you live now and where you work now.
Well, my primary training was in language. And then when I came here to United States from Ukraine, I graduated from the Bellevue, Washington University, City University, and earned a degree in marriage and family therapy. Language so fascinated me that I wanted to use it in hypnosis. Therefore, I have gone through some intensive training in neurolinguistic programming and clinical hypnosis to become a craftsman of highest degree with the words, because the unconscious mind is responding to the words more than anything else.
Well, Sophia, that's very fascinating to me. Now, let's back up for just a second. So you have a degree in marriage and family counseling.
Yes.
And that's you got that training in Bellevue,
Yes,
Washington, the state of Washington.
Yes. Mm-hmm.
And was that at the university there?
Yes.
Okay. And now tell me more about your background in language. Now, you've studied language? Or?
Well, when I lived in Ukraine, I graduated from a foreign language university and got a degree in English. So this is how my background in English began.
I see. Well, Sophie, educate me about something in our audience. Now, is it proper to say that you grew up speaking Ukrainian or Russian, should I say?
Both.
Oh, so Ukrainian is its own language,
yes,
and Russian is its own language,
yes,
and then you got a degree in English.
Yes.
Or was it English literature,
yes,
or English?
English literature and English language.
English language and English literature.
Yes.
And then here in the state of Washington, in Bellevue, you got a university degree in marriage family counseling.
Mm-hmm.
Well, that's very fascinating to me. So how long have you been in the United States?
Since 1980.
So you're a local by now?
Almost, yes.
Okay. So now, again, that progression from marriage family counseling and your interest in language into clinical hypnotherapy, how did that come about?
I was very impressed as I was going through my training with some hypnotherapy techniques that I was using with my patients. And I saw the results so quickly that I came to understand that the quickest way to get to the truth is through accessing the subconscious mind. And that really worked well for them, and it so pleased me to see the results so quickly, much quicker than talking about things to get to the essence.
Well, that's fascinating to me. So you mentioned the subconscious mind as opposed to the conscious mind.
Yes.
Is that right? Now, I think I read something about thinking about or conceiving of an iceberg,
yes,
right? And
yes,
there's the tip of an iceberg that we see, and then there's the huge portion of the
yes,
iceberg under the water. Now, and is that how you equate?
Exactly. And unfortunately, people use the 10% of which comprises the conscious mind to resolve their problems. And they don't know that the answers that they're searching for is in the 90% of the mind that can be accessed only through hypnosis and also during dreaming. When we dream, we're also in the unconscious world.
Well, Sophia, now, I have to interrupt for
Sure.
one moment. You know, the audience knows that I'm a plastic surgeon and I'm board certified and I'm primarily, Ivy League trained in big universities, et cetera. I like science.
Mm-hmm.
You know, when I talk to my patients and when MDs offer therapy, whatever it is, surgery or medical
Sure.
therapy, we like to base our treatments in science.
Right.
So my question to you is there science behind the, should I say the art, or I should say the therapy of hypnosis?
Yes. The Discovery magazine in 2004 has published an article which is based on dozens of controlled studies in the field of hypnotherapy. This is the article, Hypnosis Works. It has been published by Dr. Siegel, who has looked at all these studies and wrote this article basically telling people that hypnosis works extremely well, that MRI procedures have shown that there is a change both in the brain and in the body during the hypnotherapy procedures. He was so impressed.
Okay, so you hold as truth that there's science behind
Yes.
the therapy using hypnosis, hypnotherapy.
Yes.
Okay, so let's talk about what problems or issues or challenges can be treated or helped with the use of hypnosis. Like do you treat smoking or weight loss or pain, etc.? Like what sort of issues do you want to see in your practice?
Yes, all of the above. First of all, what I like to work with mostly, even though hypnosis is used for treatment of pain, whether pain is emotional or physical, I like to work mostly with emotional pain. It's much more interesting, even though physical pain is also an interesting part of the treatment procedure. All symptoms are signals, and most of people try to kill the messenger. The point is that most people come to therapy stuck in the debilitating symptoms, and they don't know what to do with them. So what happens is the unexpressed energy from traumatic events, memories and thoughts has been trapped in the body. And in therapy, I help people to release that energy, and then a new, like a cup in Buddhist tradition, a cup is becoming empty. They can take something in, otherwise it's full. And when I empty the cup, then they are more receptive. Now, the unexpressed energy becomes a precursor to migraine headaches, to ulcers, to constriction in the blood vessels, to heart attack, to some arthritis. So many things happen because of the unexpressed energy that is stuck in the body and trapped in the body. So people are usually trapped.
So Sophia, when you use the term unexpressed energy or energy that is trapped, that's in the subconscious?
Yes.
And it's unexpressed or unfulfilled.
Yes.
What could we say that those are typically traumatic events or pain or emotional pain or things that have happened to people, to their body or to their emotions? I mean, tell us more about that.
Yes. What is trapped in the subconscious mind are certain memories of certain events that people begin to interpret from a perspective of when the trauma happened. When they were 6 and the trauma happened, they are still emotionally stuck in that mode, because if something similar reminds them, the smell, the look, the whatever, they regress to that old trauma and feel that pain. And now it snowballs every time a new situation comes in that contains that kind of traumatic memory. It's been snowballing, and plus stress as we live daily life. And so it grows more and more and more. And to cope with these bodily messages that are very uncomfortable, people take prescription pills, they go to the extent to, they use alcohol, they smoke, they become obsessed about their work or some obsessive behaviors. They resort to all kinds of things because they are uncomfortable in their body. Their body is holding this energy, unexpressed energy, and they don't know what it is and how to even express it. Some people don't even know what's going on inside of them.
Well, Sophia, it sounds sort of Freudian in terms of you feel that the subconscious mind or subconscious emotions sort of hold on to traumas that could be many years old or that happened many years, but are manifested today as some other type of behavior or pain. Is that right?
And pain, absolutely.
So tell me more about the specifics of your practice. Do you see people who call you themselves? Are you sent patients by doctors or other therapists? Like, who do you see?
I usually see, luckily by word of mouth, you know. I don't do very much advertising. I do work with 4 doctors, 2 orthopedic surgeons, Dr. Howard and Dr. Cantor, and 2 are immune system specialists. And they send me several patients from them, even with fibromyalgia. The benefit of hypnotherapy is that I never know what a beautiful gift they're going to get from that, because they can get rid of stuff that they didn't even know that they had trouble with. I had a patient who came to me with a weight issue. And while talking to her about the weight, I asked her, when did she start gaining weight? She told me that it was the time when she had a problem with her job. And she did something not very honest at her job to punish people that were not fair to her. And as I was working with her in one session, I tapped into that energy where she held this emotion. And she started crying immediately as she began to feel the guilt and the shame of doing the thing that she thinks her conscious mind doesn't approve of. So that was the weight that she was carrying beyond everything else.
Well, Sophia, that's amazing to me. You know, most Americans, I think, have this concept of hypnosis. You know, that you get called out of the audience and you come on stage, and the hypnosis person, or I should say hypnotherapist or hypnotist makes them walk like a chicken or something like that. But I guess that's not at all. That's just sort of a Hollywood television scene. But I do actually, if it's okay, I don't think my producer will mind, I have a personal story to tell. When I was at the U.S. Naval Academy at Annapolis, one of the tests we had to do was to do this underwater swim. And we had to stay underwater with our clothes on, with our uniform on, and swim quite a bit of distance. And I was failing the test. My lungs were screaming for oxygen. I kept coming up and up. Anyway, my sister happens to be a psychiatrist. She had taught me some self-hypnosis techniques, which I consider them sort of very deep concentration and relaxation periods. And so while I was in the water at the edge of the pool, I did a little self-hypnosis to concentrate and relax and remind myself that I could actually, because I saw other midshipmen doing it, that I could actually accomplish it. And the very next attempt, I swam the entire way underwater and I didn't have to come up for air. So do you ever find yourself, say, to help people stop smoking? And you mentioned losing weight. You've talked about minimizing their pain symptoms. Like, what other practical effects can hypnotherapy have?
Depression. Very often, I see patients with bipolar depression or unipolar depression, and what I find out that a lot of it comes from, I call it delayed grieving. They were not able to grieve at the time when things were happening in their life. And once they are able to do that, it dissipates. People begin to cut their medication or stop medication completely. I have 2 sisters, both came with depression. And one sister told me that I can't recognize her. She's a different person now. And we had only 1 session with her, because my presence can also empower them, because I believe and I see the light at the end of the tunnel. And when I share with them my optimism and my belief, even that, just that helps them to feel somebody's on their side.
Well, Sophia, we only have a few more minutes, and this is fascinating to me, and perhaps you could come on the program again. But what's the difference between what you do as a hypnotherapist and someone going to, say, a marriage and family counselor or a PhD in psychology, a therapist or a psychotherapist? So how is it that you use hypnosis to access the subconscious mind? Or am I asking you the question even properly?
No, the idea is that the difference between what I do and what they do is in this little piece of paper that talks about how effective is hypnosis. It says psychoanalysis, 38% recovery after 600 sessions. Behavioral therapy, 72% recovery after 22 sessions. Hypnotherapy, 93% recovery after 6 sessions.
Well, Sophia, what are you quoting? Again, see,
This is from a magazine.
What magazine?
Hypnotherapy Networker.
Okay, so the Hypnotherapy Networker
Yes.
makes this claim.
Yes.
Okay, you know, again, I'm based in science, right? That's what I'm always trying. When we teach the public, I like to present data that they can rely upon, double-blind studies, etc. So you're asserting that at least that hypnotherapy is effective for certain conditions. You've talked about pain, you've talked about depression. And again, what about phobia? And what about the common things? At least I could associate therapy or hypnotherapy with helping to stop smoking and weight loss. Does that help?
Yes, and you know what? This is the least of the people that come to me. Most people that come to me, there's a heart problem because of the 17 years of divorce. The person has not healed the emotional heart, so her physical heart is breaking. And when we start to heal the emotional heart, her physical heart is getting better. And I have her telling here what has happened to her. She says, I enlisted Sophia's help in dealing with a heart ailment, an illness that presented itself both physically and emotionally. I lived with intense anxiety and was barely able to breathe. After several sessions with Sophia, I have experienced tremendous relief. Our sessions have changed my life and led me from despair to joy.
Well, Sophia, that's quite a testimony. Amazing.
Yes.
Now, can we give out your name? Do you have a website? Do you have a number? Is that okay?
Yes, I can give my name.
Okay. So it's, I've just got a couple seconds. So Sophia Mineyev, and how do people contact you?
My number is 601-4807, area code 831.
Area code 831, 601-4807, Sophia Mineyev, MA, clinical hypnotherapist. Sophia, thanks for coming on the program. It's fascinating.
Yes, and if you want to know more science in hypnotherapy, this is the book.
The Psychobiology of Mind-Body Healing. Thank you so much for being here.
Yes.
I appreciate it. I'm Dr. David Morwood, and this is Your Health radio and television program. I am a board-certified plastic surgeon, and we're going to take a very brief pause for a very good cause.